Hello again, everybody. It is time to talk about your medical benefits. So this year, Green Nami is going to offer three health plans. We're going to offer a gold health plan. We're going to offer a silver level health plan and a bronze health plan. So this will we've got some good choices here for you guys to be able to make. Obviously, the gold health plan is going to be the most expensive. The silver will be right in the middle, and then the bronze will be the least expensive of the options. So let's go ahead and dig into this. Let's talk about the gold health plan that is known as the Simplicity or Gold Simplicity. This is a very strong zero deductible health plan. So let's dig into this. Okay, so let's start off. When we're talking about this, we're going to be talking about your in-network benefits. You've got over 12,700 providers with this plan. This is a PPO. It does not require a referral. Your in-network benefits, as long as you stay in-network, you've got a zero deductible. You've got a no other prescription drug deductible, and you have a protection. Once you see me go through these copays, if your copays ever accumulate to $6,000 for any one individual, then you're done for the year, and Humana will pick up the rest of the tab. Remember, there's no limit with these ACA plans, so they'll pay as much as they need to. Once two people in a family have met their out-of-pocket maximum, then it covers the rest of the body. So if you have 5 people in your family and 2 people have hit your maximum out-of-pocket, then you're done for the year. It's going to be kind of tough to hit on this because that would be a lot of care, but let's dive into this. So let's talk about your first dollar benefits. Primary care. So primary care, to go see a PCP or internal medicine pediatrician, you're looking at $40. Okay. For a specialist like a cardiologist or a urologist or a neurologist, you're looking at $80 per visit. Okay. No limit on your care. Remember, preventative care is all free of charge as required by law. So mammograms, women exams, colonoscopies, children's immunizations, flu shots, all of these sorts of things are all covered at no charge for you, the consumer. Okay. Humana is really unique in the fact that they're one of the only carriers, the last carriers, to offer diagnostic x-rays, which is your flat film chest x-rays and ultrasounds, at no charge, as well as blood work, no charge. And that can be a really, really big deal. Imaging. What happens if we need a CAT scan or $4,000 PET scan or $1,200 MRI? What am I going to pay for it? Well, you're going to pay a flat $400 copay as long as you stay in network. Now, obviously, if you go out of network, which is what this column is, okay, non-network provider, they don't have a contract with those providers, so you're going to pay twice as much for almost everything. So you really want to stay in network, okay? Let's keep going down the line here. So prescription drugs. Humana is one of the last carriers to go ahead and fill as prescribed. They're going to fill your medication as you need it. So you're looking at a level 1 drug at a $10 copay. Some brand names are included in here as well. Your level 2, which is your higher cost generic drugs and brand name drugs, are going to be a $40 copay for a retail 30-day prescription. Level 3, we're looking at $70. Level 4, we're getting into the higher cost drugs at a 25% coinsurance. Okay, pretty strong drug plan. We get into, let's go down here to facility fees. Okay, facility fees, outpatient surgery. Outpatient surgery is a real big deal nowadays. Because of technology, a lot of things are being able to be done without you having to spend the night in the hospital. So an outpatient surgery is literally going to cost you $1,250 on this plan. All right, and the physician and the surgeon fees are all no charge as long as they're in network. Emergency room. What happens if I break my leg? A couple different places. They got to reset my ankle, and the bill's $6,000, $7,000. Everything that's done in the emergency room is going to be a flat $400 copay. So that's a pretty valuable benefit in today's high-cost environment. Emergency medical transportation is going to be a $400 copay per transport. Urgent care, a touch high at $100, but still, you can see that they're trying to push you to urgent care instead of the emergency room. Remember, emergency rooms are meant for emergencies. Urgent cares, you can get a lot of stuff done in an urgent care that people are in emergency rooms for that really shouldn't be. Broken bones, stitches, can all be done in an urgent care nowadays. There are some exceptions to that, but I would contact an urgent care before you go run off to an emergency room if possible. Hospitalization. If we have a hospitalization, you're looking at a $1,250 copay per day, and you're only on the hook for the first 3 days. Okay. The caveat to this is, let's say that you need to have a scheduled surgery, hernia surgery, or a hip replacement, a knee replacement, something that's going to keep you in there for a while. Then at that point, you want to make sure it's pre-authorized. Otherwise, you're going to pay more. But anything that's an emergency, you're only on the hook for 3 days. So that's a pretty good deal. If you're in the hospital for 10 days and it's a $100,000 bill, all you're paying is $1,250 for 3 days at times 3, and you're done. Okay. Physician and surgeon fees are all no charge. All right, cruising through. We're going to keep going here. Outpatient services, $40 for mental health. $12.50 is for a mental health overnight stay. If you're pregnant, maternity, once you're diagnosed as being pregnant, all your prenatal care is on the house at no charge. And then the delivery of the baby is only $12.50, which is a great benefit. Okay. Home health care is $80 copay. Rehab's a touch high. Some of the speech therapy, audiology therapy, PT is going to be $80 a visit. So, rehab, again, so some of the rehabilitation services, $80. Skilled nursing is $80. Durable medical equipment, that's a nice fee. That's no charge. Hospice is no charge. And that kind of sums it up here. So getting down into, some of the child vision and dental, really not covered. They don't cover hearing aids, infertility, private nursing duty, some weight loss programs. So I do want to make sure that you check out the summary benefit, which you should be able to download. But give us a call if you have any questions on this. This is a really rich plan. Our phone number again, 623-516-8300. Thanks for your time.